Welcome. Come with me. The doctors will see you now.
Well, welcome back to Fast Talks with Family Docs, the podcast where we look at the issues affecting family medicine, patient care, and legislative matters tonight. I'm Dr. Phil Palmer.
And I'm Dr. Veer Vidala. Today we're diving into a topic that's critical for all of us in family medicine, the upcoming Oklahoma legislative session. Advocacy plays a huge role in shaping policies that impact the healthcare landscape. And this year, we're keeping a close eye on several key bills. Joining us today is the Kari Weber, Executive Vice President of the Oklahoma Academy of Family Physicians. Welcome, Kari. Nice to see you again.
Glad to have you. Thank you guys both for having me. I'm excited to talk about this. Obviously, I'm extremely passionate about the legislation and the advocacy that physicians can play.
Well, let's jump in, Kari, with Senate Bill 1808. This bill focuses on prior authorization of medications.
Yeah, so this is obviously a key priority for the OAFP. It's been something that we hear all the time from our physicians and from patients alike, that prior authorizations continue to be an issue in delay of care. So we know that this bill is a bold reform. We know it takes some big steps. Some of the key ones that I think that we are worth mentioning is that it shortens approval time for medication requiring prior authorization. It prohibits insurers from requiring a prior authorization for anything that is denied less than 10% of the time. And then additionally, it extends the length of the prior authorization for chronic conditions from what we typically see. They kind of vary from insurance to insurance, is about 6 months. Right. And so this would be someone with a chronic condition would now have a prior authorization that was valid for up to 4 years. And then it just basically, the bill in a nutshell just cuts through the unnecessary delays and ensures that patients have consistent access to the treatments and the medications that they need.
Yeah, I think one of the things I noticed reading through this is it's what I would say putting the common sense back into prescribing and getting medicines for patients. A lot of times the forms and the hoops we have to jump through, it's like, why am I doing this over and over and over? Everybody ought to know this already. And it kind of gets rid of all of that and brings it back just to the common sense of why this medicine's important. Let me tell you, let's get it for the patient, or be clear why not.
Yeah, absolutely. I think that's the number one thing that we always hear is like, how can we reduce the administrative burden that continuously gets put back on the physician? And with that administrative burden, what it does is it just takes time away from patient care, right, which you guys know more, way better than I do. Yeah. And so we're just hoping that this improves the efficiency and the access for those patients.
Yeah, it's important to also decrease delays in care.
Yes, yeah.
I think also you were going to share with us about Senate Bill 875. I know we recently had a law passed requiring a primary care spend for entities that are healthcare entities that are doing business in Oklahoma. What is this bill hoping to accomplish with that issue?
Yeah, so we had a really big win a couple of years ago when they decided to move to the privatization of managed care. And what we did in that bill was ensure that there was an increase in the overall primary care spend. So on average in Oklahoma, the primary care spend is about 3.9%. And so that's obviously way too low. And so looking at other models, we said, okay, let's get that up. And we were lucky enough to get 11%, which is really incredible. But as we've continued to do this work and watch this grow, we've started to realize like there's actually nothing in the bill that ensures that the contracted entities have to meet that 11%, right? It says that they do, but there's no repercussion if they don't meet it. And so, sorry. And so we really wanted to look and see, like, is there something that we can do to put some teeth into this bill? And so this, what it does is says, if you don't meet that 11%, you don't get to apply for the next contracting period, just like any other business, right? So if you don't fulfill your requirements, then you're not eligible probably to be rehired or to bid for another contract. And so we really wanted to look at that and say, like, what would make it a priority? And how can we really let everyone know in the state that primary care should be a focus. And so by putting this language in, it's really saying Oklahoma should make sure that they're putting primary care as a priority when they're looking at the health of our state.
Right. So, Kari, for those that follow the podcast, would you explain to them why it's so important to protect this 11% and enforce that with insurers doing contracts in the state?
Yeah, absolutely. So we know that evidence shows that primary care-oriented health systems achieve better health outcomes. We know that it's in study after study. They also include more health equity and lower healthcare costs overall. So right now, currently in the United States, the overall spend on primary care is about 5 to 7%. And then if you look at other countries, it's like double that.
Yeah.
And so then you go like, okay, what are we missing out on here? And how could we impact the future of Oklahoma's health if we actually said, okay, what could really make an impact? And what we've seen nationwide is that when you take those dollars and you invest it in primary care, you start to see those health outcomes, you start to see those changes in people's lifestyles, and it makes a huge difference. So when we're looking at that, not only are we looking at like, what could it do right now, but what could it do in the future if we continue to invest? Because our hope would be like somewhere down the road that it's not just 11%, that it's 15, that it's 20.
Right.
But 11's a great start.
Yeah, like some people might have the perspective that this is a group of family docs and pediatricians and internists who are saying, we need to make more money, pay us more money, and we got a legislator on our side to do that. And although that is a tiny slice of the argument, I mean, primary care is so sorely needed across the state and many portions of our country that the way to do that is to have an improved reimbursement for those docs. But as you said, the majority of this spend is not to go into the pockets of the doctors doing primary care. It's to put those services out there for those patients. And when those patients come in, basic preventative care and immunizations and screening tests and things like that are readily handled, and that medications for a lot of common conditions can be available, and patients can get resources for food education and other general health care education and mental health treatment and perhaps even integrated behavioral health care services in primary care clinics. And a lot of that is really what leads to what you referred to as those improved health outcomes across the population.
Yeah. And where the patients will see this, I think this is probably a really important thing for people to understand, is when you're looking at the 11% spend, yes, there will be stuff that is based on CPT codes, right?
Right.
But then there's a whole chunk that is based on non-CPT codes, and that directly is those programs that you're talking about, those services. If you look at the value adds of an insurance plan, like maybe it is increasing or decreasing the need for food security. There's gift cards, there's gym memberships, there's nutritionists, dietitians, all of those different things that you look at and you go like, those are things that could also assist a physician in ensuring that their patient is able to comply with what you are asking them to do.
Really providing these patients with resources for a healthy lifestyle and public health.
Right.
And so
Yeah.
that's, I mean, not right now, but even passing that on for generations, it starts with 11% almost.
Yeah.
Yeah, no, when I started practice with dark hair, there was a discussion of we need to move away from a healthcare model that pays docs for taking care of illness and allows primary care docs to help people be healthier.
Yeah.
Yeah.
But the reimbursement system doesn't pay for that, and there's no encouragements or inducements for patients to necessarily pursue that. And so having this 11% spend into primary care to benefit the wellness of a population, it certainly does make sense why we need changes in this legislation to hold the insurance companies accountable to actually meet that goal and have that spending if they're going to continue to provide care for the population of the state.
Yeah, and continue to remind the legislature how important primary care is. We know that health is a huge priority to them, right? And health outcomes and measurements in the state. And so really reminding them like primary care could help you get to those health outcomes that you're searching for.
Yeah. Fantastic bill, Kari. Fantastic bill. Now let's talk about House Bill 1812, which establishes standards for doctors supervising APRNs. Now, Kari, this is always a hot topic. Can you tell us more about the intent behind this bill?
Yeah, actually, we have had so many discussions about expanding scope of practice, especially with the APRNs. And a lot of the time we hear that it's too costly. It costs too much for me to be supervised for a physician. They charge too much. Or maybe there's no real set standard for supervision and what that looks like, and they don't feel like they're getting a lot of supervision. And so what we did is we said, what can we do proactively here? What can we do to put in place that would answer some of the concerns that they are having? And so we looked at capping the cost. So this bill puts a cap on the cost. It also devises a plan for the boards to set standards for supervision. So what does that look like? It requires them to have a contract that states what that looks like and what's the responsibility for the physician. So this isn't anything to do with the responsibility of the APRN. This is us looking at ourselves internally and say, how can we be better? And we can do that by putting some standards in place, right? And we wanted to say, we don't want to be a problem. We don't want to always be a naysayer. We want to be a solution. And so we looked and said, what can we do to do that? And I think this bill addresses it pretty well.
Yeah. Now, family medicine's focus for a long time has kind of been the patient-centered medical home and a concept of team-based care. How would this bill support and encourage that concept of team-based care?
Yeah, absolutely. It just reinforces that importance of collaboration, right? So that agreement is a collaborative agreement between the physician and the APRN. But it then still ensures that it's a physician-led healthcare team. And by addressing these concerns, we're fostering that collaborative relationship and that team-building atmosphere, right? Like we want it to be something that both the physician and the APRN feel comfortable about without compromising patient safety, right? And I think that's the biggest thing that we wanted to address here.
Yeah. And beyond these bills, Kari, we always talk about the scope of practice creep. It's a recurring concern. Can you elaborate at what's at stake with these proposals to expanding prescribing authority for NPPs?
Yeah, I think when we look at it, it's more than just APRNs, right? Like when we're looking at the bills that are up this session, chiropractors, right. Psychologists, we are looking at CRNAs, nurse midwives. Everybody is wanting prescribing authority, right? And so when we're looking at especially Oklahoma, where we've made some strides, right? We want to make sure that patients are safe. And so really and truthfully, when we're looking at these bills and evaluating them, we're like patient safety first. We're not looking at it as a turf war. We're just looking and saying, okay, without adequate training and supervision, are we compromising care? And that is something that we don't want to do. And so we're looking at each of these bills to ensure that we're not compromising that care and that we're putting the patient first and ensuring that that patient safety is the number one priority for us.
So as we interact with our state senators and state representatives, as family docs, how do we communicate that concern to them? What's the best approach in your mind?
Yeah, the data's great, right? I share a lot of data with them, but really and truthfully, the number one thing that a physician can do is share real life world experience. So when has physician oversight made a difference? What are you seeing on a daily basis? Is there a time that you saw something negatively impacted? Those are the things that make a difference when you're talking to a physician or to a legislator as a physician. They want to know about what you're experiencing in your day-to-day practice and how this will impact it. So I can show them the data and it's really great, but the things that move the needle are when they get to hear from you in particular to how this could impact you and your practice.
Yeah,
that's great. Thank you.
Well, Kari, another area we're watching closely is vaccine-related legislation. What type of trends are you seeing? What types of bills are you seeing now? And what's the Academy's stance regarding this?
Yeah, I think over the last couple of years, we've continued to see a lot of anti-vax bills. This year, there's not as many bills, but we're continuing to see that same trend of increasing vaccine hesitancy, right? It's the initial thing of always saying, have you made sure you've properly explained the risks? There's nothing about talking about, have you explained the health benefits of a vaccine? And so I think a lot of it is about just increasing the hesitancy in a state that's already, we're seeing the vaccine rates drop drastically year after year.
Yep.
And so we want to address anything that could negatively affect public health in Oklahoma. And so the Academy stance on it is we just will push back on anything that is negatively affecting public health or discredits science. The other part of the vaccine bills that we're seeing now is adding administrative burden back on a physician. And that's what we're trying to remove constantly, right, is administrative burden. So one more paperwork, one more step, one more thing that a physician is responsible for maintaining in records. I think this is a new trend. We haven't seen this one. This is a completely new trend that we're seeing in terms of putting a lot of administrative burden back on the physician's practice.
Yeah. So I'm old enough that I remember maybe not so much remember as a child, but I know the childhood vaccines I got. And then as a physician going through medical school, entering practice, looking back on that and reading and learning about that, there were a lot of very frightening childhood illnesses and diseases that struck children that caused brain injuries and sterility and claimed lives, that there was excitement 30 years ago about we're finally getting rid of these diseases that have been taking our children and harming our children. And unfortunately now we're seeing those diseases pop back up in the United States. And so what can the listeners and viewers of our podcast do to support evidence-based vaccine policies?
Yeah, I think several things that come to mind are obviously talking to your legislator. If you are a concerned physician, a concerned parent, talking to the legislator about the importance of vaccines and the importance of herd immunity in our community, right? I think that's number one. The more that we speak up about it or the more we talk about it, the more it is at the forefront. The other thing that we combat all the time is social media. There's so much false information out there. So I think physicians have a really unique role and perspective of being able to use what they've learned in medical school to explain. And I think people have probably forgot. Right?
Yeah.
Like you're saying, those diseases were eradicated at one point, and we haven't seen it. And we're seeing outbreaks in states very close to us in our own state. And so I think constantly being an advocate, whether that's at the legislature with friends and family on your own social media platforms to help combat some of the disinformation that's out there. I think those are ways that we can really make an impact. It all comes down to spreading the word, right? And hoping that we can make a change and getting people to trust medicine and what it has done in the past that has kept us healthy.
Right.
And not going to a place where we're fighting those diseases again, especially, when we think about it, it's kids. You want your kids to be healthy. I want my kids to be healthy. And so really helping people understand maybe what the severe consequences can be if our immunity numbers continue to decrease at the rate that they are decreasing.
Yeah.
So, Kari, is there a link on our state academy website or on the National Academy website if people want to reach out to their senator or representative to find that number? What's the best way for people to make those connections if they don't already know who represents them at the Capitol?
I always go to okhealthypolicy.org. It's my favorite. It's really easy. You just scroll to the bottom, you hit find my legislator. All you have to do, very simple, put in your address, and then it will pull up. It pulls up your U.S. Senator and Representative first, and then you scroll down a little bit, and then there's your state senator and your state representative. What's great about that site is it links directly to several things. You click on it, and it'll link to their webpage at the legislature. It has their email on it, usually their contact phone number, their web page, so you can actually look at what your legislator stands for, right? You can click on that link and see a lot of them also have their social media handles and different things. So you can follow them through session to be able to see what are they voting for? What are priorities to them? You can also see on that what committees that they're on, because it's really important if they're on like public health and human services or health committees. Anything like that for us is really great, because then we can speak to those who are seeing those bills firsthand before they ever hit the legislative floor.
Yeah. And if people haven't done that before, they may not get their senator or representative when they call. They may get a staffer calling them back, but and they might not even get a human. They may be busy, and you might get a voicemail because people are in the office talking to them. But my experience is if you leave a message, someone will reach back out to you always.
Yeah, I think they're really great at doing that, about responding, whether it's via email or by phone. I think what people need to remember, and I think sometimes people forget, is they work for us, right? Mm-hmm. They were elected to work for you. If you are a constituent of theirs, then their responsibility is to reach back out to you. So if you're not hearing from them, continue, right? Yeah. Or talk to us at the association. We can help put you in contact with them as well. And staying connected with the Academy is great. I mean, Dawn, our legislative advocate, she puts out every week a kind of like a recap of everything that's gone on during session. And then the Academy always does speak outs or alerts on special bills that we need help with. And so obviously there's several that we're really pushing this year that we'll probably be reaching out to our members about. But if you have anything that you're passionate about that you see, just sending them a brief email. I think a lot of people think a lot of the times that they have to like send some really detailed, long explanation, and you don't. And they really are interested in hearing what you have to say. Yeah.
And thanks for mentioning Dawn. Big shout out to Dawn for her hard work.
We couldn't do it without
Trying to keep her head above water at the start of the legislative session. But, we love everything she does to help us out at the Capitol.
Yeah. Well, Kari, thank you again for being here and giving us this insightful information. For people who are just turning charts every day, it's kind of hard for us to stay up on top of the Senate bill, so it's really important for us to know what's going on in our state.
Yeah, and we appreciate all of the help and the support that we get from our physicians. We have a really incredible, active Oklahoma group of physicians that are passionate, I think, about our legislative process and the bills that we've run, and we couldn't do it without you. So I just want to thank you guys for everything that you do as well.
You bet. And viewers and listeners, thanks again for your time. And as we've said many times, advocacy starts with you. And so until next time, this is Phil Palmer and Vera Vidala. Thanks for joining us on Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.